Perhaps more than anyone else in America, Ralph De La Torre, the CEO of Stewart Healthcare, is the poster child for this outrageous corporate greed that is permeating our for-profit healthcare system. Our first witness is Dr. De La Torre. But as I think everybody can see, Dr. De La Torre is not here. So I now call up our second panel of witnesses.
The corporatization and commodification of healthcare is the guiding ethos of Stewart. It's the one and only priority. Chronic understaffing has resulted in preventable harm and even death. Probably the most tragic and what finally blew the lid off all this was the death of a 39-year-old woman who came to the hospital, had an absolutely normal childbirth, was bleeding. She may have been saved by a device known as an embolism coil. There weren't any in the hospital. There hadn't been any in the hospital for weeks. They had been repossessed by the vendor. She died.
What would you have done with the $800 million that Cerberus took out of the system? What would you have done with the $40 million that Ralph De La Torre used to buy his own private yacht? What could you have done with those revenues?
We could have had beds that work. I mean, I work on the 10th floor of a building. There are supposed to be 6 elevators. One of them is working. A single elevator. They gave us these sleds, so we're supposed to do a lateral transfer. If there's a fire in the building, you go to the next building. And they gave us these sleds to drag patients who can't walk. I'm 65 years old. Do you think for 1 minute I can haul a patient down a flight of stairs on a sled? If we had enough staff, we could make do with missing some other things. But for every person you take away from the bedside, you increase the risk to the patient who's left without care. The moral injury that occurs when you're unable to do the one and only thing you want to do, and that's to keep patients safe and to take care of the best care that you can of a patient, of all my patients. But for the greed of Stewart in the way they deliberately, and it almost feels malicious, deprive me of my colleagues, my support system, my supplies, my equipment. I'm just worn out.
If Dr. De La Torre thinks that he is comfortable by not being here today, Dr. De La Torre, if you're watching, you're wrong. This will be pursued.